the question box, and we'll see that, and CJL, our moderator, will be able to help you out with that. So I'm assuming people can still hear me because everything's gone silent. Look, just before we start, I would like to give people a brief introduction about Health Consumers New South Wales. We're expecting nearly 90 people today, which is fantastic and very exciting for us. We're a peak group for health consumers in New South Wales, founded in 2010, and part of our main mission is to help provide good quality information for health consumers around how to influence the health sector, and also good training and good evidence-based information to people working in health services around how to improve and ensure consumer engagement in the work that you're doing. And we're really excited today to be able to present this model of consumer and community participation to you. Many of you will hopefully have seen this that I'm waving around, which was emailed out to people in the with the information for the webinar, which brings together the model that Serena's helped us put together. And before we start, I do also want to acknowledge the support of WentWest, the Western Sydney Medicare Local, now the Primary Health Network in Western Sydney, for their support and help and partnership in developing this project. And in particular, I'd like to thank Walter Kemmett, their CEO. Walter was unfortunately can't be with us today, but his support has meant so much to getting the project together and completing what I think is a really fantastic model that you'll hear about shortly. And also the other colleagues out at WentWest, Michelle Warwick, Rachel Barker and Donna Sedgman, who have all contributed and supported the project, and our consumer representatives who we couldn't have put anything together without, in particular Alison Kakani and John Leedon. Thanks both of you for your help with all of this. So look, as I said, there'll be room for questions as we come along. Please put questions and comments into the box as we proceed, and I'll now hand over to Serena for the bulk of the webinar. So thank you, Serena.
Thanks, Anthony. Welcome, everyone. I know there's a number of people that I already know who are attending, and also plenty of people that I haven't met yet. So, but really appreciate that you've come along, that you've registered today. The first thing that I'd like to do is to actually ask you to participate in a poll, because I think it's useful for us, but it's useful for you as well to know the makeup of who is actually attending. So if you could participate in this short poll, and our moderator Sijal is setting that up. So please use your mouse to click on you're participating today as an interested consumer, or a consumer representative or consultant, or health services staff, or health policy staff, or researcher and academic. And that will just be useful information to know who's the audience. This model is probably very much a tool for health services, but it is also a tool for consumer representatives, and I'll talk at the end about some of the ways that a consumer representative can use this model in part of their representation, in part of their work. So we've got some results coming through. So we've got 8% interested consumers, 19% consumer rep or consultant, 54% health services staff, and 19% health policy staff. So thank you everyone for participating in that and coming along. I'm going to give you an outline of the webinar today, and I'm going to give an introduction, a short introduction, but also talk about why we engage. I won't delve too deeply into that, but I do want to touch on it. And in the section that addresses the model, we introduce it in 3 stages. In the first stage, I talk about the key concepts that are at the heart of the model, and there's 3 of those. And in the centre, we talk about the evidence and the best practice that actually underpins the model. And there are 6 strategies that we've identified that really roll up that evidence and best practice. And then talk about the model in its entirety and what the different elements actually relate to. Finally, we'll talk about some of the ways that you could use the model, either as a consumer or as health services staff. And finally, there'll be time for questions that Anthony will moderate at the end of towards the end of the session. So Anthony mentioned that this project, this model, is an outcome of a joint project, and it was a project that was set up between Health Consumers New South Wales and WentWest, who were at that time the Medicare Local and are now the Primary Health Network. And the aims of the joint project essentially were to work within WentWest, to embed consumer involvement across WentWest, but also to develop tools and resources for use across New South Wales. And we've been very proud we launched the model at a Networking Health New South Wales forum at the beginning of June, and we're continuing to promote the model and share it. So we like to see it get out there into the public domain. There's quite a bit of backup information for the model, and I first want to let you know that there is actually a detailed report with references that really pulls together best practice and evidence that we've looked at to develop the model. And that report is now available online, and we've provided links within this presentation, and you'll get emailed the links afterwards. So if anyone wants to really dig into what's behind it and find out more, that'd be the place to go. You've seen a PDF that was sent out with the registrations for this webinar, and that's got a 4-page brochure essentially that's quite useful for sharing the model. That can be quite a useful artefact to actually give others that you work with information about the model. And contained within the centre of that brochure is the model itself as a A3 poster. But we've also got a link to that as a poster itself. So those links I've provided here and again at the end of the presentation. So before we really get started, I want to put a bit of a caveat on the model. You may have seen this. It's something that's popped up over the internet at different times, and I'm sure many of us will be familiar with the concept that is behind it. Success is never a straight line, so difficult things, it's tempting to make them appear simple and straightforward, but in actual fact we know they're not. They're quite complex, and really consumer and community engagement is actually quite hard to do well. It's at least meaningful and effective engagement is definitely hard to do well, but we know it's really worth doing. It's a powerful and valuable tool in delivery of health, and the evidence shows that health consumer engagement is worth doing. So we can't neatly package it into boxes, but what we do believe is that it is so valuable that it's worth being very clear about definitions, and it's worth getting really specific about what we're talking about, what can be achieved, and how it can be achieved. And that's really what we're trying to do with this model. And while we've got the designers to help us make it look attractive so that it was easy to use and easy to look at, but we also want to get the message across that we don't see this as a completely finished product, and we know it's actually going to evolve. So we're still quite interested in your feedback and where people take it and what you end up doing with the model. So looking at, well, why we engage, and there is quite a bit of information on this in the model, in the report. But really the rationale for consumer engagement comes down to a number of areas, and one is ethics and human rights and democracy. A second is actually improving the outcomes of the health service that the engagement is around. A third is actually developing relationships with partners in provision, or also partners in consumers and the community that we're actually working with. And of course they're serving a strategic or a political purpose as well. Now they're the different reasons that will be given at different times for why actually do consumer and community engagement. But I want to actually pose the question differently, and I want to ask you, what is the objective of consumer and community engagement? So if you have a community engagement or consumer engagement program, either in your health service or that you're participating in this as a consumer, what's going to be different as a result of those programs? What's actually going to change as a result of those programs? We believe that actually consumer-centred care is the objective of the primary objective of consumer and community engagement, and if engagement is not improving consumer-centred care in some way, then it isn't really being totally effective. And we're also using the Australian Commission on Safety and Quality in Healthcare definition for consumer-centred care, and that is healthcare that's respectful of and responsive to the preferences, needs and values of patients and consumers. So now, beginning to look at the model, what did we take into account? Well, we looked at the evidence in the literature, we looked at the latest research, including research based in Sydney, in local health districts and consumer engagement at Southwestern Sydney Local Health District. We also looked at the industry best practice and the literature around that. We looked at the context for WentWest as a Medicare local initially, based in Western Sydney with a large and very diverse population. And also we looked at the general transition to primary health networks and what that meant for engagement. But we absolutely also took into account the consumer perspective. And I do also want to thank Alison Kakani, who's an employed consumer consultant at WentWest, and her consumer insights were invaluable throughout the development of this project. So in talking about the model, there are three key concepts that we wanted to introduce. I've talked about improving consumer-centred care and saying that that really has to be recognised as the objective of our engagement. We also wanted to talk about top-down engagement, and we describe that as partnering with consumers to design new or improve existing services. And also we talk about a broader kind of engagement or ground-up engagement, and see that as partnering with communities to better understand the gaps and the access issues and any unmet health needs. So what do we mean by those terms? Well, top-down engagement, we really recognise that there's a whole range of engagement that's going to be driven by health services or health policy development. It's going to be service focused. It may very well and most likely be initiated by the services. It's probably looking at the known health needs, and it's also looking at the existing or the planned services. And this, for example, could be co-designing a new service, consulting with consumers on the appropriate materials to give to consumers and community. It can also mean involving consumers in the evaluation of the service. I've got a great case study of a feature story here of an example of top-down engagement that was being run out of WentWest, and it also features our consumer partner, Alison Kakani. And this is being run out of the Western Sydney Partners in Recovery program, and that is a program that really provides support for people who have persistent and severe mental illness and usually have quite very complex needs. And it's also a partner, it works in partnership with a consortium of service providers where WentWest is actually the lead and the coordinator, but works through other service providers. This is a really good example where consumers have been involved in service evaluation. So it's an existing service and it needs to be evaluated. Now, this is also a great example, and I like it because it isn't just run by the health service, because in fact there's a consumer consultant running this evaluation, and that's Alison. So that's Alison, that's her role. She's on the right-hand side of that photo. She developed a client survey with input from her Consumer and Carer Forum, and this is a survey for clients who are either with the program or have completed the program. Now, the postal survey wasn't particularly effective, so they hired Bronnie, who's a consumer herself, and she administers that survey by phone, and they've actually got a really good response rate now running that survey. The Partners in Recovery team are now using that data not only to report to the funding body, but also to work with the service providers in the consortium to improve service delivery. But importantly, if in talking to a client through that survey they actually uncover a problem for that particular client, they make sure it actually gets addressed without delay. So it's a lovely example of a service evaluation that's been initiated by the service, but it partners very, very well with consumers to run that. So taking back to that third concept we talked about, which was ground-up engagement, I know a number of you will be quite familiar with what we're talking about here. It's community-focused engagement. We think it's important that this can be initiated by communities, and that's something to take into account in planning how engagement interfaces with the community in a sense. And it's partnering with communities, it's better understanding their needs, it's developing solutions with communities themselves. And it's going to be looking at where there are service gaps, where there are access problems, and any other unmet needs that aren't, perhaps they're not being met, maybe they're not well understood, or we haven't figured out the best way to deliver them yet. A lovely example of this out of WentWest is Thrive at 5 in Doonside, and this is it's jointly funded by WentWest and the Western Sydney Local Health District, and it's a whole of community program, and it's working with services, it works with parents and community members across the area, and the focus is on children's school readiness skills and health of 0 to 5 and long-term health as a result of their school readiness scores. So it's looking at reducing barriers to services that are already there, but also identifying fun ways to help children develop school readiness skills. And one thing they did, which was terrific, was they interviewed parents of children 0 to 5 in the area of Doonside about what they believed were the strengths and the weaknesses and the opportunities for families with young children in the area. And they also invited parents and community members to join the local community partnership group. And they've rolled out some exciting programs, quite a number of exciting programs there. And this is a photo from Baby Rhyme Time, which was something that actually went hand in hand with a mini top soccer program to get kids using their social skills, their motor skills, and actually really having some fun with their parents around literacy. It's a lovely program, and it's still working well in Doonside. So there's some examples of top-down and ground-up engagement. There's obviously many more that we could talk about, but just coming back again to those three concepts of consumer-centred care, top-down engagement and ground-up engagement. How do they actually interact? We felt it was really important to identify the way they interact, and in identifying that, actually being able to measure it within an actual engagement program in the health service. So if we look at what feeds from top-down engagement into consumer-centred care, really we'd be looking for identifying service improvements and also identifying and bringing the consumer perspective or the consumer journey back into care. For example, where there are organisations where at committee meetings or board meetings a consumer story is always shared at the start of the meeting, and that's a way of taking valuable insights from that top-down engagement and bringing it back into the actual delivery and running of healthcare. Looking down at ground-up engagement, well, what do we expect is actually provided from ground-up engagement into consumer-centred care? Well, we would expect there'd be new programs and new needs identified in the community, and we'd also expect to identify strategies to reduce barriers to care. There's actually a third one that needs to be added there, and that's new partnerships that have developed as a result of that engagement with the community, partnerships to work with and also to deliver services. It works the other way too. Top-down engagement relies on the actual health care we need to get consumer experience measurement from the actual healthcare delivery to feed into engagement processes, particularly into evaluation processes. But we also would hope to identify new consumer representatives, perhaps people who've given feedback on a service or had a problem with a service or had a great experience with a service and they're interested in giving back. There are some inputs as well from consumer-centred care back out to partnering with community and ground-up engagement. Probably the most important one is actually raising awareness in the community of the services that are available. There's some opportunity for reporting performance to the community, but really the most important thing in partnering with community and ground-up engagement is actually listening, not telling. So that one's there because it's valuable, but it's probably not the most important when it comes to ground-up engagement. So they're those three key concepts. And we're going to jump out of model now to talk a little bit about 6 strategies that are based on evidence. Once again, if you want to drill further into these, they are in more detail in the report, and they're the result of looking at a whole range of barriers and facilitators to consumer engagement. It's also worth noting that on the back of the brochure, the PDF that was emailed out to you, there's a little blue box, and that actually lists these 6 strategies as well. The first is to ensure consumer engagement is a priority. And really this includes involving consumers from the beginning, not halfway through or towards the end. And it means support from senior management for consumer engagement, and that's resources as well as actually moral support. And it means involving consumers in governance. Secondly, it's essential that health services address their own internal organisational facilitators, and we mean by that internal governance, the accountabilities for engagement and where they lie in the organisation, but also the built-in opportunities for consumers and communities to initiate engagement. So that's how porous is the organisation for communities to say, look, we'd actually like to talk to you about a problem that we've got, or we've got a problem accessing a service. Third is actively include disadvantaged or marginalised groups. This is a really important one, because if we merrily go along and set up consumer engagement in ways that suit us, because that's natural, what will tend to happen is we will engage with people a lot like ourselves. And what that means is that we're then not hearing from the voices who are not readily able to engage, the disadvantaged, the marginalised. Sometimes they're referred to as hard to reach groups. So if we don't specifically have strategies to engage with these groups, and it won't necessarily be bring them onto a committee, there'll be other ways to do it. But if we don't do it, what we actually do is we perpetuate health inequality. So it is a really important one to consider. The fourth strategy is to build the capacity of consumers to engage. This has actually been pretty well recognised, and it's really important. It's about providing support and training to consumers. It's actively supporting your consumer reps and the work they're doing, and that can mean the really practical stuff like making sure they get the printed materials, or they have access to a printer, or they have someone that they can call with an issue that's just got to be resolved, and that there's a coordinator or a facilitator who can, on a fairly regular basis, debrief with the consumer representatives, or at least ensure there's a networking opportunity for consumer reps within the organisation to actually debrief with each other. And the flip side of the fourth strategy is to actually build the capacity of staff to support engagement. It is really important for staff to understand and value the role of consumers, and also to support the staff that are involved in engagement. Have those staff connected up, perhaps through a community of practice where they can share all the resources that they might need, but also share their learnings, talk and touch base on the different ways that they've been able to get some engagement, or even just share documents like terms of reference and position descriptions. And six, which is definitely not its last, but it is not least, and that is to focus on outcomes and evaluation. That means not only measuring consumer experience data, and there is a lot of work coming out on this, patient-reported outcome measures and patient-reported experience measures, but it's also, this area also is about evaluating engagement and focusing on the outcome of engagement. So it isn't merely about evaluating the process, but it is, well, what was the impact? What impact did this engagement have? And that actually can't start too early. It's really valuable to actually look at the beginning of an activity, how will this be evaluated, and to incorporate the consumer's view in what actually would make a successful activity and involve consumers in evaluating that. So, and finally, it's actually publishing results, because this has actually only been done in a very patchy way. It does actually hold the field of engagement, consumer and community engagement, back a little bit, the fact that there is only limited publication, limited research published in the literature around engagement, and we would absolutely encourage everyone here who's involved in engagement programs to consider how you can publish and how you can evaluate and how you can publish your work. So I raised these because this is essentially what the model is based on. So I'm now going to talk about all the elements of the model. And if you have happened to have printed out your PDF brochure, or you've got a brochure with you, you could follow along with this. But I've got these slides are optimised for PowerPoint. We've talked about the processes that contribute to consumer-centred care. There are a number of other elements, and the first one we wanted to talk about was consumers involved in governance. And really, that is really essential to say that consumers are coming first, or consumers are a really important part of the organisation and an important part of planning and delivery. Primary health networks are adopting this in some way with the formation of community advisory committees. There are all sorts of different ways that's being done. It's valuable for all those networks to ask what governance role will the consumers play in the primary health network. Equally, across local health districts, consumers have played a number of different roles in governance, and I know that the national standards have required that consumers have some involvement in governance in different ways, and I understand this happens in a variety of levels within different organisations. We'd certainly recommend that this is something to always keep in mind. It is actually part of the engagement program. Another foundational element is the guiding principles or values upon which the entire engagement program is run. Many organisations enshrine these in their engagement frameworks. They give you a frame of reference for the way in which consumers and staff and management all interact with each other, and they can be used by any party to hold the other party to account. They're quite important. The other area of the model, and it relates to three of the elements that are listed, and they're the critical inputs. We really can't expect to be successful in this unless we put some resources and some effort into actually making it happen effectively. And we're recognising here, and a lot of these critical inputs do actually relate back to the strategies, the 6 strategies. So we've included internal capacity, partnerships and integration, and consumer and community capacity here. Internal capacity, again, that's your organisational facilitators, and it's the staff having the training and the support to be able to actually support the engagement programs that are being undertaken. It's resources, it's funding, it's senior management support. Partnerships and integration is an interesting one. We hear a lot more about integrated care for good reason, because a person who has an illness is one person, and they don't really like being split up into various parts of the health system, and it's quite difficult to understand sometimes. When you're looking at your engagement processes, do consumers, are they restricted to the area that your health service is working in, or is there a possibility that primary health and local health districts can actually be quite integrated in the way that you engage with your consumers and communities? Thirdly, consumer and community capacity. this is a pretty important area because you can have a fabulous engagement program ready to go, but put an ad out in the paper looking for consumer reps and get a handful of phone calls from people. Really building up the consumer representatives within an organisation, that work with an organisation, does require quite a bit of work. It requires building the consumers themselves. Consumer reps can come to an organisation with a lot of experience or a small amount of experience, or a small amount of representation experience but a lot of life experience or other professional experience. And it really does require building up that capacity, supporting those consumers. A great network of consumer representatives that work with an organisation can actually become, support themselves, can begin to support themselves, in fact, very well. There's a number of papers that Health Consumers New South Wales has released some, put some out in our newsletter about mentoring, and we heard it at the Networking Health New South Wales Forum about some terrific examples of mentoring, consumers mentoring consumers. Of course, there's also the flip side of to balance the whole model, we need key outcomes, and of course we're looking at improved health outcomes in a way that relates directly to the consumer-centred care, to improving consumer-centred care. But we'd also not just look at patient health outcomes and experience outcomes, but also improved community outcomes in the sense that there are fewer gaps, needs are being identified and needs are being met, and community health could actually improve as a result. But as I've said earlier, evaluating engagement and having evidence of engagement, these are really important outcomes of the engagement processes and engagement programs. Capacity and capability building. So as consumers and health services work together and actually carry out engagement activities, they each develop more confidence and experience, and that keeps feeding better and better engagement. It improves engagement skill and engagement capability. So these are all part of the outcomes of the engagement process. So that's the whole model, and obviously there's a fair bit there. What we're hoping that the material is available to you, it's read up, like to read up. I'd certainly encourage anybody who feels they haven't had their, they've looked at that answers, then please do contact us. But yeah, I've just taken you through the PowerPoint version. The version I've just shown on the screen, this is the poster version, or the one that's in that you'll find in the report and in the brochure. So looking just quickly now at possible ways to use the model, I first wanted to actually focus on the way that consumer reps or consumers could use this model, because I'm aware that it is very much about the policies and strategies of an organisation, although some of you will be really familiar with that sort of thing anyway. But we see that this is something that you could use to promote best practice engagement with your health service. For, take the model and talk to your health service about it. We also think that for any engagement activity that you're part of, you could use this framework, particularly the key outcomes, to say, well, this activity looks great. How will this contribute to improving care? So it just leaving the screen, it went to sleep for a second. How will this contribute to improving care? How will this activity contribute to improving consumer and community capacity building? And how will it be evaluated? And those are questions that you can ask at the beginning of any engagement activity. And so they are the key outcomes from the model. The model in its entirety, particularly if you're in a governance role or you're in the position where you actually have an input on an organisation, a whole engagement program, you can use this, the literature review in the report, but also the model to critically assess the design and implementation of the engagement program that you're involved in. I hope that you could also use this model to help you to contribute to the evaluation plan of engagement within the health service that you work with, or the policy committee that you're on. And also I would like to see that this helps you to be involved in the monitoring and the evaluating of the engagement that you're involved in. And for health services, you could use this to either establish or to review your governance for engagement, perhaps review even the role that consumers are playing in governance for engagement. You could use it to establish or to review your principles for consumer and community engagement, and I would encourage you to do that with your consumer representatives. It's definitely something to work on together. You could use the model to review the infrastructure, your critical inputs. How well set up are you to actually be able to implement this kind of engagement program, implement the model as we've shown it. It's certainly possible to start all of this without having every single thing in place, but it's well worth you understanding where you are at with those critical inputs and perhaps have a plan for how you would continue putting other things in place that perhaps you don't have. You could also identify your engagement processes. Is it predominantly top-down? Is it ground up? Is it a mixture of both? And identify what the inputs are from those engagement processes to consumer-centred care so that you can monitor. You want to be able to monitor the outputs from engagement, the inputs to consumer-centred care, and monitor the actual impact so that you can actually report, well, our engagement program did these things and we monitored these were the actual direct inputs to consumer-centred care and this is the impact that it's had. And it also would be a useful tool to develop an evaluation plan and evaluate the outcomes from across your engagement program. So what we've talked about today, I've given you a brief introduction. We talked about why we engage, particularly what is the objective of engagement. We've looked at the model. There are 3 key concepts that are at the heart of the model. There are 6 key strategies that underpin it. The full model is actually 11 elements in the full model. I've just briefly talked about possible ways to use the model, and we'd love to hear from you about what you think are ways to use the model, and we're going to have time for questions in a moment. But I really want to get this message across. Please do use the model and publish. Please publish your results, present them at conferences. Definitely look at getting them into the journals. But we do encourage you to adapt and modify the model. It's a starting point and it's not an end point. More links, we'll provide those again at the end for the full model, the poster and the brochure. So this is the model as we've given it to you today. I hope that before too long that it looks something like, it's taking time to load, I hope before too long it can look something like this. Please use it. Scribble on it, have it stuck up next to your computer on your desk, make it a talking point. We really encourage you. So thank you very much. I'll hand back to Anthony now for questions, and I'll leave my links up on the screen so that that's always available. So I'm just waiting now for our moderator to bring it in.
Okay, look, thanks, Serena. There's been a couple of questions as we've gone through, and one of them's been around some timing and how long it takes to actually set up a framework around using the model for an organisation.
I think that's an interesting question. It's probably a how long is a piece of string question, which is that's not an answer, I know. Of course, you can get started with engagement by deciding to involve consumers in a forum or a committee, but I think to give this entire framework a chance, I can imagine an organisation, while they're getting started, actually spending 6 months to 12 months actually really thinking about this and developing it. But certainly within 12 months of getting started, I'd expect you could have a framework that could be based on this. And yeah, we'll come back to your resources. In more detail in the report, we talk about the need to have a champion within the organisation, and that's somebody who's at the senior level who can influence others across the organisation, and also having a facilitator or a coordinator. And that certainly is it's people and it's money. And if those things are there, things can move a lot faster. If those things aren't there, it could move a lot slower.
Mm.
You definitely need financial commitment. It needs to be something that senior management has committed to for things to move quickly.
Yeah. And I think the thing that I'd also add is this is a dynamic model. So yes, it's about establishing processes, like Serena's talked about, but I think it's also realising that with engagement, whether it's consumer engagement or community engagement, it's not as though an organisation can think, oh yes, we've arrived, we've done it, and we're here. It's about realising that this is a dynamic process that's ongoing and linked to quality improvement processes. So again, I don't know if that's a helpful answer or not, but I think it's worth remembering that once it's set up, it's ongoing and should sort of set up its own feedback loops. Look, we've also had a couple of questions around some examples around the type of capacity building skills that is needed for both consumers and services. People are asking for examples of that. I suppose just before I hand back to Serena, that's a great opportunity to let people know and remind people that Health Consumers New South Wales actually provides training and support for both consumers and health services. And if people are interested in finding out more about our own training programs, please get in touch with us. But I'd also, I suppose, just go back to Serena and ask around any particular examples of capacity building skills that are needed around helping engagement.
That's another big one. Consumers, to start with consumers, to view consumer representatives that are involved with a health service, and really in a big health service there can be dozens to up to 100 potentially consumer representatives that are involved, and I guess to view these people as an incredible resource and to actually put back into that resource. So do they have a facilitator that they can get in touch with if they've got problems? Have they got ways of communicating with each other so they can support each other? Are there informal or formal opportunities for consumers to be mentored by experienced consumers? And are there ways, are there opportunities to actually celebrate and to recognise the achievements of the consumer representatives that are involved? I know one organisation holds a consumer conference once a year where their networks of consumer representatives come together and present things they've done. I believe there are awards provided, and the work of the consumers is recognised to staff as well in newsletters and in external publications. So that's actually a way of really developing the capacity of, I mean, they're people in, it's almost another workforce, but it's a different kind of workforce, and it does needs input, resourcing, support. In terms of the capacity of the organisation, it is really important that the skills and the know-how to engage with consumers, that it's actually recognised as quite an asset, and that's probably where the role of the champion for engagement, that senior person who does speak out for engagement and champions for it, but also the facilitator, and whether it's a way of running a community of practice, having a knowledge centre or a knowledge on an intranet, but certainly making and also regularly promoting what the engagement program does, particularly promoting the achievements of the engagement program. And that then comes back to, you need to actually measure the achievements, you need to evaluate the engagement so that you can then talk about the contribution that the program's made.
And
So,
Serena, sorry,
yeah,
just picking up on that. So sorry, everybody, but just picking up on that. Once there is a sense of what the achievements have been, there's been a question come through around publishing, because obviously one of the big things that we all need to do is to build up the evidence and let people know what's working and to publish. And there's been a question about what journals would people recommend publishing in. And before we get to that, I'd also say that as important as publishing in journals is, and something we should all try and work towards, publishing in journals isn't the only way to get the evidence out there. And if people have evaluations or reports that can be made published and put on websites and things like that, that's a fantastic way to get things out. We're in the process here at Health Consumers New South Wales of building up the evidence base, so people can send that to us as well, and we'll make sure that's available online as a way to do that. But just, Serena, I was also wondering if you had any thoughts around where to publish and sort of good places to look for that.
A couple of things. There are the consumer publications, such as the Consumers Health Forum of Australia has Health Voices. So that's a publication that comes out. It's not a journal, but it's something you can have short reports published in. Health Issues Centre Victoria also has a publication. I can't recall its name, but Health Issues Centre Victoria, you can certainly find them on the web. There are also a couple of journals. I believe it's the Australian Health Review is a journal on management, health services management. There's also the Australian Primary Health, Journal of Australian Primary Health Care. So there's a number out there, but certainly, as Anthony says, journals will be, certainly they're the pinnacle, but they're one of the hardest things to publish in. And there are the other reports that come out regularly, publications that come out from the organisation. And there's another one put out by the Australian Health and Hospitals Association. AHA put out a publication, and that's something else that can get into. Conferences, of course, and there's a conference at the end of the year, but there are others that are appropriate as well. I guess once these things, if they're shareable and we can get them into the net, it's a learning for everyone. Whether it becomes something in the literature or whether it's something that just actually generates learning across the networks, whether it be New South Wales or Australia, it's of great value.
And look, Health Consumers New South Wales is always available if people have questions or want to know where a good place to publish something is. If you can't find anything through your own networks, please come back and talk to us and we'll be happy to continue that conversation. And there's another question that's been raised around someone looking for ideas around engaging disadvantaged and marginalised groups, which is, again, another huge question about how we do that, and something that we could devote, I suppose, at least another webinar to down the track. I know this is an area that Serena has particular interest in, so realising that in a couple of minutes we're not going to be able to answer all those questions, perhaps, Serena, you could give us some insights about some good places to start there?
Well, places to start are actually to look around at who already engages with those consumers in your area, and also look at the community organisations in your area. Yeah, some hard to reach groups, you do need to really exercise some sensitivity. They won't necessarily be willing and able to come and engage the way it might suit you. And I think getting in touch with whether it be the Aboriginal, local Aboriginal organisations. There may be some homeless support area. It could be migrant and refugee support services, or even disability support. But it's actually to get to know who is actually in your area and in your domain. And firstly, those organisations themselves may have people that actually are interested and willing to actually be representatives and advocates with you. I would definitely begin by finding who those groups are, finding out what they do and getting in touch with them. It's definitely about working through what already exists within the community rather than starting from scratch.
And so look, the sound just came in and out there a bit, so I'll just repeat the main message from Serena around getting in touch with the local people in your community who are working with marginalised groups. And really, this is one of the core of what we hope can be achieved through ground-up engagement, by partnering with the community, finding out what's there, and again, as Serena says, finding out and targeting those local groups who are working with or already connecting well with marginalised people in the community and connecting with them. I'm aware of time and that we've only got a few minutes left, and we might not, I'm afraid, be able to get to all the questions. But we've had a question about the guiding principles and values that underpin the model. Some of that's actually answered in the report that will be released very shortly. But it's also, I think, important to recognise the guiding principles and values of the organisation and how they link with engagement. And Serena, just in the couple of minutes we've got left, I was wondering if you could just touch on that around our values and the guiding principles that we've mentioned underpinning the model.
Sure. Look, and I'm talking from memory, but the different examples that I've seen, it really establishes the ground rules for interaction, and it tends to be around trust, clear communication, working together in good faith, being aware of conflict of interest, and that engagement will be meaningful, that it's not tokenistic, that they actually get into consider and do something with work they do or the advice they provide. It tends to be that sort of in a way they're almost motherhood statements, but they give a fun. This is the way we and it allows staff and management and consumers to say, look, we agreed we work together this way. Let's make sure that we're sticking to that.
No, look, that's great. Thanks, Serena. And as we said, a lot of those questions and many more are answered, I think, in much more details in the report that will be available soon, that brings together the evidence that's behind the model, and we'll be sending out information and links to that to everybody who's on the webinar. Now look, I'm aware of time, and I think unless there's any more questions that people want to sort of put in now and pop up in the next minute or so, we might end it there. I can see a few people who are sending their thanks, which is fantastic, and thanks to everybody who's joined in. This is our first webinar, so we'd be very interested to hear from you about your experience of it. Please fill in the evaluation that you'll be sent shortly, because we'd like to hear what we can do better. I'm quite excited that Health Consumers New South Wales has been able to do this, and also around such an important topic. And again, I'd like to thank everybody involved, but particularly Serena and the hard work that she's put in. I want to acknowledge and thank Serena. So thanks everybody. I can see More thanks coming through. That's great. I'm glad people appreciated it. And I think we might call it a day there. But thanks, everyone. Unless, Serena, you've got some final words?
I just appreciate that everyone came to the webinar. Thank you. Thanks for those who've actually lasted through to the end. And yeah, look, I really would love to hear how it goes. We'd love to get feedback on what you think, and if you're using it, we'd love to hear what you think. Thanks again.
Yeah, absolutely. So thanks so much, everybody, and we'll be in touch soon.